Hey guys, so in today's video, I wanted to talk about what is nurse bullying. And when I say nurse bullying, I don't just mean that it is bullying between nurses. It could be a nurse to a CNA, a nurse to a PCT, whatever the case may be. That would be considered nurse bullying. So there are a lot of different forms of nurse bullying, and since I was sharing nurse bullying stories recently, I thought that it was important to talk about what actually constitutes nurse bullying, what is considered bullying, and discuss it, because I think sometimes people go through this form of bullying and may not even realize that it is actually considered bullying. So if you see me looking this way, I do have my laptop open with some notes, and you're going to hear the pump kick on in a second because I'm doing laundry. So I apologize. There it goes. So some forms of bullying, nurse bullying, that may be fairly obvious are belittling, which is harshly or unfairly chastising a colleague for doing a subpar job, especially in front of patients or other clinicians. Now, in my own experience, I have actually experienced this particular form of nurse bullying. Specifically, at my very first CNA job, I was floated for the very first time, and I had no idea where I was supposed to be going, what I was supposed to be doing, what the routine was on this other unit. And like I said, I was a brand new CNA, and this person, I went and asked for help, and I brought the tray to the wrong room when the person that I brought a tray to was actually supposed to come out and eat at the table because they hoarded food in their room. And this other CNA actually pulled me to the side, and she screamed at me in front of all of the residents that were eating dinner, the other nurses, the other CNAs, the other staff, and nobody did anything. Another one is minimizing, which is telling a colleague who is struggling to suck it up. I have had that before, and honestly, ever since I've experienced certain forms of nurse bullying, I have taken the step to kind of step it up and be there to help my colleagues as much as possible, because I know what it feels like to be drowning on a shift and not get any help. And so I tend to go out of my way to try to make sure that my colleagues have what they need and are able to get help. Name calling, which is referring to a colleague as a bad nurse or a bad CNA. I think name calling could also be like literal name calling, whereas you're calling someone out of their name, or calling them derogatory names or derogatory things. And I don't appreciate that whatsoever. Like, even between friends, I prefer to be called by my first name, which is Robin. And, I don't appreciate being called anything other than my name. Another one is yelling, raising one's voice to intimidate or scare another person. That is pretty common sense. Pushing or shoving, which is committing acts of physical aggression toward a colleague. Again, you would think that would be common sense. Blocking someone's way, which is preventing a person from leaving or going where they want to go. Again, I would think that would be common sense. Kind of just getting in your face and doing things that make you feel uncomfortable would also be considered nurse bullying. Not helping you, things like that. Like, it's very easy to get into the nurse bullying realm without even particularly realizing that that's what this other person's behaviors have become. Some nurse bullying is not as apparent as the ones that I just talked about, and so let's discuss that a little bit. Ostracizing is considered nurse bullying, which is purposely not including a colleague in conversations or group activities that contribute to morale. I have also had that happen at a facility where the entire unit that I worked on was supposed to be having like a little celebration. I think it was because we had like no falls and no absenteeism for like a specific amount of time. I think it was 60 days. And so we were supposed to be having like cake, there was supposed to be ice cream and pizza, and everybody else kind of just left the unit to go get all of these like ice cream and pizza that they had in the kitchen. And nobody even told me that this was going on. I had been off work for the prior couple of days, and, you know, they all ate their food and celebrated in the kitchen while they had other staff covering the unit. And I was very confused why there was suddenly new people there, and nobody told me what was going on. Also, like, there would be times where people would be talking and I would come into the room and ask them like what they're talking about, and they would just automatically say, oh, nothing, it was just nothing. When you know, when you walk into a room and people have been talking, and then as soon as you enter the room, they just kind of stop. It's really frustrating, and I've had that happen multiple times. Another one is gossiping, spreading rumors about a colleague. I actually had this, I think I made a whole like in-depth video when this particular incident happened at one of the long-term care facilities that I worked at. People would go around saying that I left all my people wet and that I never changed anybody and that there was brown rings around people, which there wasn't. Like, I made sure that I went out of my way to go and make sure, even if it was like 5 minutes before shift change, I was constantly like changing the people, especially the people that I knew were heavy wetters, or people that, you know, like you could change them and then you roll them and they're wet again. I made sure to go out of my way to make sure that those people in particular, which were the more difficult people to change, were changed like literally 5 minutes before shift change. They would also say that there was a smell left in the rooms that I worked in, which was also untrue. I took pride in the work that I provided at that facility, and a lot of people would just kind of like do the bare minimum to get through the shift and be able to go home. And I made sure that I would take their trash out, you know, even if there was just a tiny little bit, like maybe a couple things in the trash, I would empty their trash. I would make sure that if they needed linens washed, they got washed. If they needed just a little bit of extra housekeeping, like sometimes people would have a lot of clutter or like food and stuff on their trays, and I would try to clear that off if the person would let me, because you know how that goes. And so people at that facility would say that I always left my rooms with a smell. They were dirty, my patients smelled, and my patients were all wet, and I never changed them and I never did anything. And they used to say this all the time. And honestly, I had talked to like the charge nurse, I had talked to the DON, nobody did anything, and they continued to treat me like that. And so I left. I gave my notice and I left. Another one is ignoring calls for support, which is ignoring another person's calls for backup, forcing the person to complete hazardous tasks alone, or to delay care until another nurse becomes available. I have also had this happen, not so much with other CNAs, but other nurses, where like, especially I've told you guys when I worked on the trach unit, it was literally me and one other nurse. There were no other CNAs, which was very difficult and very dangerous. Especially when we had particular residents who would try to pull their trach out on a consistent basis, or people that would purposely like try to roll out of their bed, and their trach could become dislodged very easily. And not just that, but like there was a particular nurse who would sit behind the nurse's station, and she would have headphones in for the entire shift. She would be talking on the phone during the shift. She'd be watching YouTube videos and things like that. And I would have to roll and turn like people that were bigger than me, like 300-pound bedbound people who cannot help you whatsoever. I would have to turn those people myself. And half the time, like there was one particular resident who, she was so large that like there was literally no room to turn her. And I would have to turn her by myself. And she was also a heavy wetter, and it was very, very hard because like turning her, there was like this much room on the other side of the bed. So I would have to pull her towards me and then try to flip her over and hold her there at the same time. And that's how I actually injured my back, like really bad, was with that particular resident. And so it was very frustrating. And a lot of times, like I would let that particular nurse know that a patient or a resident needed pain medicine or was asking for a breathing treatment or things like that, because we did have a few on the trach unit that were more behavioral and not necessarily trach patients. But they would ask for like a breathing treatment, or they would ask for Tylenol or ibuprofen or Motrin. And that particular nurse would always say, oh, they're just being dramatic, they don't need it, blah, blah, blah. And so I would get a lot of shit for it the next morning when day shift came in, either the day shift CNAs or the day shift nurses, because I did my literal best to try to take care of these people. But like, I would be going from the time I got there until the time it was time for me to go home, most of the time. Like, I would say 95% of the time that I worked on that trach unit, I was going from the time I got there until the time, you know, it was time for me to go home in the morning. And I still got a lot of shit because I could not get everything done because it was just me and this nurse. And whenever this nurse worked, it was just me, really, because she would sit at the nurse's station the whole time and not help me with anything. And a lot of the times she would connect their feeding tubes the wrong way, even after I had showed her how to do it, which I'm not even supposed to be doing feeding tubes as a CNA. But I knew that, you know, if you turn it a certain way, the feeding tube formula comes out and doesn't go through the tube. And she would always leave it so where I would have residents that were bedbound, not able to help me move them at all, and they would be covered in feeding tube formula because she would leave them that way, or she would connect it wrong and she would just let it run through instead of checking to make sure it's going in the right way. And then when I would ask her for help bathing those patients, because I would have to give them a bed bath because they'd be sticky and feeding tube formula has a smell to it. And so I would have to give them a whole complete bed bath, change all of their linens and everything, and she would not help me. So I would consider that nurse bullying as well. But hopefully this helps. If you guys have any other questions about nurse bullying, or you want me to share more of either my personal story with nurse bullying, or more information about nurse bullying or other people's stories like I shared recently, please let me know. I'd be glad to get something filmed for you. And with that being said, that's all I have for today. So I hope you guys are having a wonderful day, and I'll see you guys next time.